And we are recording. Okay. Okay. Well, hello, everybody, and welcome to this episode of Therapy Thursday. It is December 3rd of 2020, and we are back with another wonderful informational session for everybody. Again, my name is Evan Adler. I am with UNC Healthcare, UNC Therapy Services, and part of the Community Engagement Committee, bringing you this series of informational talks. So I'm really glad that that those who could join us are here today. Today we have a very special topic with a specificity of youth sports. So we have Catherine Duncan back with us today to talk about injury prevention in youth sports. An ounce of prevention is worth a pound of cure. I know that there are lots of my friends out there who have kids who have been cooped up for the pandemic and kind of returning to sport and just gonna go out and get it as soon as they can. But we want to make sure that they're doing it safely. And then this certainly transcends into past the pandemic and really is kind of that off-season training and whatnot. So with that said, I'm going to turn it over to Catherine, who will give a little introduction of herself again and take us into this topic. Before she starts, I just want to say that if you have questions during the presentation, please go ahead and put it into the chat, and we'd be happy to answer them as we go along. We'll probably save some time at the end for questions, but if it's something urgent, we can kind of pop in there and kind of pepper them in as needed. Also take a look at the chat because I'll put in some links down there for our Facebook page and for where to find this on YouTube. If you've missed it today, you want to watch it again or send it to a friend who might be interested who couldn't make it today. So with that, I'm going to turn it over to Catherine.
Welcome, everyone. I'm glad you're here and glad you're interested in injury prevention, which is one of my real passions. I have been a lifelong participant in athletics myself, played college soccer, and I have been coaching since I graduated from college, in addition to being a physical therapist. And as a therapist, we see lots of people in their adult years who had injuries as a youngster, and that led to them having osteoarthritis, or maybe they've limited their activity because of an injury that was a long time ago. What I really feel like we could do an important service is in injury prevention in the first place. So we're going to dive in a little bit into that today. And what I'm hoping is that this presentation will spark some questions you have, and you could bring that to our attention, but also to make this very much a discussion, because some of the things I'm going to bring up are really philosophical things that we may have some other opinions that I would really like you to share when we get to the end. So what I'd like us to look at just briefly at the data of sports participation and injury rates, because it's quite staggering. Look at the pros and cons of early specialization in youth sports, which has become really pervasive. As well as present some recommendations for injury prevention programs. So it's estimated that about 60 million youth participate in some kind of organized sport. Now, that could be team sport, it could be individual sports, but something that is more than just free play on the playground. And it's now recommended that kids get an average of 1 hour of physical activity per day. So many youth quit playing their sports by the time they're age 15. And there's several things that come up in the research as to reasons why. The most primary is that the pressure has gotten too much. So it's no longer fun. It has become a pressure cooker. So we're going to talk about that when we look at sports specialization. But another reason may be injury. So we're hoping to keep them engaged. So injury in the research is defined in different ways. And so it's important to consider what that means. Because injuries in the research they tend to be injuries that are reported or injuries that someone has gone to seek care. But nobody really knows the number of injuries that are the little things that we just say, oh, get back in there and play, little Johnny, you'll be fine. And sometimes those are more significant injuries than we thought at the time. Now, I'm a coach and a parent, and I understand there are many things that we want them to just get back up and get in there and play. You know, the skin knee or something like that we can say, hey, you're okay. But there are times where we're probably putting kids back earlier than they may be ready to be participating. And that the injury rates are up to 8.6 million reported injuries per year. So again, that's staggering. That's about 14% of the participants. And 50% of those injuries can be attributed to overuse. And overuse injuries, in my opinion, are not just my opinion, these are preventable injuries. We could be doing something to reduce 50% of our injuries. So the American Orthopedic Society for Sports Medicine and the American Academy of Orthopedic Surgeons has teamed up for a public awareness campaign to try to encourage injury prevention, and they're really promoting this reduction in early specialization because of the overuse injuries that it can lead to. They're calling this their One Sport Injury campaign. And early specialization, that's when a child, it's defined as a child who participates in one sport, usually year-round, at the expense of playing other sports. So they have chosen to focus entirely on one sport, or they play that one sport year-round and they add an additional sport on top of that. And we often assume that this is going to lead to their ability to develop to an elite level. There are many kids who are hoping to go play in college or beyond, and it's promoted even by us coaches as being, really necessary to play this year-round to get good enough to go to that next level. Some of it may be true, but not necessarily. And in the 2017 NFL draft, in the 32 first-round draft picks, 30 of them were multi-sport players through their high school years. So until they were 18 years old, they were playing more than one sport. So they were going from, football to basketball to track, or they were playing running cross country and then playing basketball and, lacrosse, things like that. And we find with kids who play multiple different sports that they develop improved motor control, improved core strength. They develop better patterns of how to use their body, which helps them in whatever their final chosen sport happens to be. We don't often see multi-sport players by the time they've hit college years, but at that point they're physically mature or close to it. So some of the problems with early specialization are it can limit your motor control development to being just within the realm of that particular sport. It also stresses your tissues in that particular plane. So, for example, running. Running is a very front to back activity, and those same loads constantly being applied to an immature body doesn't allow it to develop stability, strength, control in side to side, or maybe in rotation or vertical. And it leaves behind the weakest link of the chain. So again, let's go back to the runner who's always going forward. They may have weakness, let's say, in the side of their hip, but it's not really addressed well in their sport. So they continue to strengthen things this way when really what they need is to add some strength side to side. So maybe complementing running with a sport like tennis, it's a lot of side to side, could be something really beneficial from a motor development standpoint for that athlete. One of the biggest problems we see as physical therapists are the early specialization that can lead to overuse injuries. And again, these kids that are playing year-round with very few breaks, they don't have a chance to have some recovery, and many of them play on multiple teams, especially through those middle and high school years when you've got the opportunity to play, let's say, middle school basketball, but you're also playing on the AAU team. Or, you're swimming on your year-round swim team, but you're also going to swim for your high school team. Another important one is baseball. You've got kids that are, they may have a limited pitch count for a pitcher, but if they're playing on 3 teams and each team has the pitch count for that child, well, they're clearly exceeding that recommendation by 3 times. And the other big problem is that it's a blessing and a curse. When you specialize in a sport, you can develop extremely advanced technical skill that sometimes exceeds their growing body's physical capacity to tolerate that level. So that's a really difficult balancing act to play. You want them to develop that technical expertise, but we need to be careful that we're not going beyond what that individual athlete's physical capacity allows. So some considerations for injury prevention programs. One is they should recommend avoiding early specialization and instead encourage some multi-sport participation. Now, that doesn't mean you can't have, the kid who really loves, I'm going to go back to soccer, playing in their fall and spring season, but maybe in the winter they play ice hockey because that's one of the things they like. And in the summer, they do the summer swim team. So things like that will allow them to continue to develop other motor skills. Another important thing is that the program balance training volume and intensity with rest and recovery. So it's a misnomer that that constantly pushing to and beyond your capacity will develop your strength, because really the rest and recovery is a period when that pushing actually helps you build. It's very much like learning. If you are trying to learn new material in school, you really need the sleep in order for your brain to assimilate that material into some organized fashion that it can then recreate that information to use when it's necessary. So that rest and recovery is a really, really important feature. Another thing to consider is that individual's development, social, physical, and emotional. Some kids, I've coached kids from age 3 and 4 all the way through high school. And, I'll never forget a child that I coached when he was in 5th or 6th grade. So those kind of middle school years. And he would often go down on the field and he'd come up crying and have to come out of the game. And I'd let him sit down for a minute and just say, you tell me when you're ready to go back in, but your team needs you. And when he would get himself back together, he would go right back in the game. Well, I guarantee you, by the time he was in high school, I also knew this person. He was not at all like that. He had completely grown to where he knew if he was, hurt, if he needed to come out, he'd say, I need a minute out. If he wasn't, he would just get back up, brush it off, and play. So understanding each individual's stage of development is really important in helping prevent injury and dropout. Another thing that that injury prevention programs need to consider is that they really work on technical skills, including the technical skill of things like running. So even though we assume every child who can walk can just get up and run, but there are techniques to running that can improve efficiency, motor control, and injury prevention. So even things that you think might be very basic, working on that technical skill is really important. It also means that coaches need to be well trained to identify when a technical skill, when a technique might need some individualized work. So some of the key elements, and we're going to talk about each of these briefly, that need to be in an injury prevention program would be strength training. And yes, I mean for kids, strength training. Plyometrics, and we'll talk about what that is in just a minute. Screening and development of proper landing techniques and sport-specific technical skills. Adequate rest and recovery, which we mentioned, and a balanced nutrition and hydration. And then also, this is important, but rule changes in equipment development to allow for improved safety and participation. So lots of people think that kids can't do strength training. Well, kids can definitely do strength training. They may not until they've reached puberty and they've got some testosterone flowing. They are not likely to get big and bulky like you would expect, from Arnold Schwarzenegger. But they will develop improved motor control and strengthen their muscles at their level. So they absolutely should do strength training, and it can be part of their practice program. So the SAID principle, and we'll talk about that, the body adapts according to the work we do. And when you work hard, allow for recovery, you're going to see an increase in your strength. Unfortunately, it takes about 6 weeks to see measurable results in strength. But if you sit on the couch for 2 weeks, you lose 60% of your conditioning. So, if you go on vacation and your child just sits and plays video games, they're going to lose a lot of whatever conditioning they went into vacation having. So doing some activities while they're on vacation is a really important thing. So the SAID principle is specific adaptations to imposed demands. And if this is your level of demand, you're going to have a child who has a difficult time going back and participating in PE and playing their sport. But if we work hard, we do some strength training and motor control training and technical training, you're going to create an outstanding athlete. So your strength program should include all muscle groups, including the core as the primary one, which would be trunk, spine, postural muscles, and we'll visit some of these exercises in a minute. It should include some upper body activities, including for someone who's a runner or a soccer player or a basketball player. And it should include lower body activities, hips, knees, feet, and ankles. So plyometrics are activities that your muscles have to generate their force, generate their work at a very high speed. So skipping, jumping up onto boxes or a curb, doing little speed ladders, or tossing med balls are examples of plyometric activities. So we as physical therapists and athletic trainers also will do screenings for mechanical faults or technical issues, and technical training needs to be part of these injury prevention programs. First and foremost, we would look at posture, but jump landing skills are important, as well as sport-specific things such as throwing mechanics, swimming stroke mechanics, and sliding or diving onto the ground. So one of the pre-participation screens that we use clinically is, again, looking at posture, looking at an overhead squat, which we'll show you examples in a minute, single leg squat, jump landing technique, single leg hopping, prone planks, and then again, depending on the sport, we would look at sport-specific movement patterns. So here's an example of a postural screen. Too often, especially when we have kids doing home Zoom school, we see the rounded shoulder, rounded back posture with a forward head, which is really, it can cause shoulder injuries. It shuts down the muscles in your hips, so you don't, you put your hips, knees, and ankles at risk. So working on posture is very, very important. This is an overhead squat. So it's assessing motor control of your core and your shoulders. It allows us to observe flexibility at your ankles and how you use your body to push off of the ground. So here are some faults that I wanted to point out with someone with doing when we look at an overhead squat. One would be if your toes are turning out or your knees go out. Another would be your knees going in or shifting from one side to or the other. So a single leg squat, again, this is looking more at your lower extremity strength. And running, for example, is a single leg squat with 2.5 times your body weight, time and time again. So this is a really important skill. Jump landing, so we can jump off a curb, a stool, a bench if they're at the field. And again, we look at the techniques as we did in the overhead squat, that hip, knees, and toes are lined up. And then a single leg hop, which is like doing a single leg squat, only you're jumping and landing. Prone planks, and one of the things that are that's very useful about a prone plank is it helps you assess core strength. And again, the core, that's your trunk and your abdominals. So we can assess core strength there. We can look at neck strength, and we can look at their shoulder stability. So in this picture, you see the youngster in the front, his chin's a little bit jutted out. The one in the back, he's got it just a little bit better. So that's something that's a very simple thing to fix that we could work on with planks. Here's a couple of faults. One would be the saggy back. I see that a lot with my players, so we work on that control. And the other would be sticking their tushy in the air. So some things that influence mechanics would be technical skill development, strength, flexibility, equipment, fatigue factor, and the environment that they're in. And those are generally things that we can modify. So we can improve technical skill, strength, flexibility. We can work on all these things. Now, the non-modifiable ones, I put an asterisk on this for a couple reasons, but we can't change the age or the physical maturity of the athlete. So often, particularly when we get kids, probably from 9 or 10 until they're about, for girls, maybe 14, 15, for boys, a little older than that, their maturity at a given age can be completely different than their teammates. So, for example, swimming is often one that the kids are advanced by their age group. And you'll have a 13-year-old who looks as if they are 20 years old, physically very mature, swimming against someone who is prepubescent. And they don't both have the same capacity to do the same thing. So it's challenging for someone who's prepubescent to perhaps swim, 8,000 yards in a practice, whereas the person built like the 18-year-old can handle it. So that's something we really need to consider in our training. Another would be their ultimate physical capacity. There's some evidence that we can push our individual envelope, for example, with our cardiovascular capacity, but we will reach a point that's the maximum for us as an individual. And that is something we, as coaches, constantly striving to push an individual to their personal capacity, but it may look different than another athlete. And then the asterisk I put in non-modifiable is the access. So there is a tremendous difference in access to quality coaches, social support, facilities, and equipment that is very socioeconomically driven. And it's challenging to see a child who could potentially be an outstanding athlete but can't participate on a team that has that a high level of coaching or quality of play because they don't have the $3,000 that it costs to join that particular program. So that's something that I hope we as a society will continue to address. So another key to an injury prevention program is built-in adequate rest and recovery. And I think a lot of youth athletes are really deprived in this category, particularly the more elite level kids. They don't get enough sleep because they train before school and after school, and then they come home and they do all their homework and they have to eat dinner. So they actually would develop their strength and control better if they were able to rest a bit more. And I will say I have been absolutely fascinated by what I'm seeing in some of my return clients, those that were out during COVID and couldn't do their same, maybe 8 episodes of practice per week for their sport, how they actually are coming back stronger, fewer injuries. I'll see them for things that are more prevention associated, but they feel better, stronger, faster than they did before they had to back off during COVID. So it's quite fascinating how much this rest and recovery has helped them actually progress.
Catherine?
Yeah.
Sorry to interrupt. There was a question in the chat here that kind of relates to this, and I don't know if you wanted to tackle it now or later. But it was if you recommend when a youth athlete is ill, just a regular cold or something, should you still try to do something physically or allow them the rest, or what your thoughts are on that?
So I'm going to say it depends. And I'm sorry, I can't see the chat because I'm working off of one screen. So you'll have to fill me in if there's one to interrupt. In terms of illness, clearly if someone has a fever, they absolutely should not train with a fever. Your body is fighting something that it needs to fight. You will recover much faster if you respect that and let your body heal. If you've got, one of the simple colds, and I'll say simple colds, meaning, you got a little stuffy nose, it doesn't really prevent you from breathing well, but you just might cough now and again, you should be fine to participate. But if you're coughing up a lung and you can't do your sprint, whether you're a runner or playing another sport or swimming, then your body is telling you need to rest and recover. And there are times where a child might be okay to be in school because they've got, a cold, but they try to go and do their physical activity, and it just isn't working. They can't breathe well. They really need to rest. And you will find that you heal faster, recover faster from that episode if you allow yourself that time. So yeah, that's a challenge, because you don't want the kid who just says they have a little bellyache but it's not, it's an anxiety related bellyache or something else, to not be encouraged to participate. But you also need to let them recover if they are ill. And really, we have banned on our, I coach high school soccer, we have banned sharing water bottles because too many times they whatever one person's got goes around the whole team. I hope I answered that well enough. So recovery between practices and competition is essential. So what I mean by that is that coaches need to consider what their week, month, season looks like. So there may be times where you're going to push to where they really don't have a lot of rest and recovery for maybe several days. But then you need to follow that with a bit of recovery in order to be able to push again at a level that is going to help you get stronger. One of the things there is a lot of evidence for is high intensity for a shorter duration of your practice. So for example, if you've got a 2.5 hour, and I'll use soccer as an example. If you're trying to train for 2.5 hours, I'd be willing to bet after about 90 minutes, the quality of what you're getting out of that group is probably starting to go down. So you have to weigh, would you be better off saying, okay, for 90 minutes or for 2 hours, we are going to really pay close attention. We're going to play excellent soccer. We're going to really push ourselves, but then you're going to stop. You'll actually find that you get more out of it. The other thing would be taking time off between seasons. And it doesn't mean you have to go back and do the couch potato thing, because remember, it only takes 2 weeks to lose 60% of your conditioning. But time off between seasons, meaning go do something else. So if you've been, playing baseball for 8 months, 9 months, maybe it's time to take 4 to 6 weeks off and do something else. Go swim, go run, maybe take up some cycling, but do something else to give your body a chance to develop some other motor skills. And, the other thing to consider is how many games, races, or competitions are appropriate in that particular sport in a given day, weekend, or season. So again, considering that you need time for recovery in order to actually perform better. Balanced nutrition and hydration, I can't emphasize enough, particularly these kids when they're at school and they've got a lot of work to do, and sometimes they skip lunch because they need to go visit so-and-so teacher. Well, they need to not skip lunch, and they definitely need to be drinking, and the primary form of hydration should be water. Not soda, certainly not coffee or, soda. Coffee or just sugary drinks, but water, good old-fashioned water. And finally, one of the really important things that we're starting to see, in part due to a lot of the concussion research that has come out in the last few years, but rule changes and equipment development that is definitely contributing to a reduction in injuries. And some examples are soccer heading. It's now recommended that no heading be done until the age of 14, and it needs to be taught so that they do their technique is good. Football returns, they've reduced a lot of injuries by reducing some of that run back kind of collision. Wrestling weight, so not the High School Athletic Association limits the amount of weight a wrestler can lose from the beginning to the end of a season. And then development in helmets for cycling and football has been tremendous. Using mouth guards and eye protection in sports, including women's lacrosse. And now in 2020, we have masks. So an ounce of prevention is really worth a pound of cure. It can save a lot of time out because of injury. And again, we just to note that we can reduce 50% of the injuries that we see in youth could be prevented if we just consider the issue of overuse. So now I'm going to leave it open to questions.
That's great, Catherine. Thank you so much. I mean, really great information here. There was one question that came in before asking for any tips for communicating with parents who are more invested in their kid's sports performance than the kid, maybe the kid, maybe over pushing them or pressuring them to specialize at a young age. How do we get those parents to buy in, to get them out of that one sport mentality?
So I feel like often, again, as a parent and a coach, I can look at this from both ends. That I feel like often the push for your child to excel in the sport or school or whatever is more to do with your own desire to be the competitive parent, to appear to be the best parent, and to know that your child went to college playing XYZ sport. Well, those are a lot of those are the kids that are quitting their sport when they're 15. They're burned out. It's too much pressure. It's no longer about fun. So really, what the experts suggest now is not just suggest, I think they're trying to beat it over our heads, is let it be kid driven. If the kid says, I really want to swim year round, I love being in the water, let them do it. But it's really important that the kid be the one to say, this is the thing I love and this is what I want to do, rather than the parent driving that. And if the kid is making excuses for why they can't go to practice, maybe we need to listen to understand deeper. Why is that? Are they really just burned out? Have we pushed them too far?
Great, great. Got another question that came in saying, what type of sports do you recommend for lifelong physical fitness?
So for lifelong physical fitness, for the first and foremost, you need to discover something that you really enjoy. And this is something I've done with my own kids. Is my kids sampled so many sports. They would see something and say, "Ooh, I want to try that." Great, let's go try it. Until you find something that brings you joy. Because if you don't love it, you're probably not going to stick with it. So that's first and foremost. But secondly, sports that tend to perhaps minimize impact are often ones that are maybe easier to sustain throughout our lives. That said, we have lots of runners that are running well into their 80s and feel perfectly fine. So I think if I have to name specific sports, I would say that swimming, walking, or running, cycling, things that don't require another person and very minimal equipment. Hiking is another great lifelong sport. But I think now it's easy in many places anyway to find even team sports. If you really love to play basketball, there's just about every YMCA I've ever heard of or seen has some kind of recreational programs even into adulthood. I definitely think strength training, weightlifting kinds of activities should be a lifelong physical fitness activity.
Great. So I have a question. I've had I've had patients, youth athletes who are very specialized in their sports, and they're excellent at what they do, and may want to get involved in another sport, but they may not be able to perform at the same level at that sport. Have you had experience with this? And is there you have recommendations for those those athletes to find a gateway sport for them so that they can be involved year round doing a secondary sport.
Yeah. So interestingly, I my own kids had this situation, and they played year round on the sport that was their club sport, and then both of them had other sports that they played in their off seasons, which we did make sure they had off seasons. And one discovered that he liked his secondary sport better than his primary sport, and that became his primary sport late in high school. So I've also had kids that I've coached. In fact, I remember a specific child who was a gymnast and really wanted to try soccer, and she was in middle school by then. So, come on out. Like I said before, those athletes who have played multiple sports end up better athletes even in their primary sport. So you think of a gymnast learning to play soccer, well, she already has some movement patterns that are really well established that allow her great control and stability. So you just have to teach her how to manipulate a ball. Sorry about that. Forgot to turn this off. Oh, not sure why it's doing that. So, so I think that, yes, I would encourage the athlete to try the new sport, and they probably need a bit of coaching on a more psychological level to understand, hey, you're going to be learning something brand new, embrace it, laugh a little at yourself, make sure they have coaching that will allow them to pick up the technical skill that they need in order to not be discouraged by taking up the new sport. But the more you allow someone to do that as a youth, the more likely they are as an adult to be willing to try something new and novel. I think I would also recommend, if my child was coming out for a sport that they've never played before, is talking to the coach, and allow the kid to talk to the coach if they're old enough to use their words, and say, I'm new to this, can you help bring me up to speed on some of the things that you might expect a kid to already know, like, I don't really know the rules, can you explain some of these things to me? So that's also important.
Great. All right. Well, we're coming up on 1:15 here, so we're going to have to to say goodbye. But I want to thank Catherine so much for her presentation today. A lot of great information. I put in the chat. Sorry, wrong button. I put in the chat the link, our link for our Facebook page and for our YouTube channel. So I invite you all to please go ahead and be our friend on Facebook and follow us on YouTube. You'll be able to see all these great informative talks. We will be having another talk in 2 weeks from today, the 17th, and our topic, I believe, is going to be running after therapy. So once we graduate our runners from therapy, what can they be expected to do and continue to grow as athletes? So, or even you're just recreational runner. So, thank you, everyone. Hope you had
Thank you for coming.
yeah, hope you had a wonderful Thanksgiving. Enjoy your December, and hopefully we'll see you in a couple of weeks. And it'll be right back at the same link that you clicked today, so you can save that or find us on our Facebook page. All right. Thank you, everybody.
Thank you.